Hello, and thank you for joining us on Zambia Today. My name is Faith Katai. Government through the Ministry of Education has recorded significant milestones aimed at expanding access to quality education, improving learning outcomes, and strengthening education infrastructure across the country. Some of these achievements include implementation of the catch-up program and improved learner health by collaborating with the Ministry of Health through the Health Learners Program. To give us more information on these key achievements, my guest in the studio is the Ministry of Education Principal Public Relations Officer, Mr. Clive Kalunga. Sir, welcome to Zambia Today.
Thank you so much. It's always a pleasure to be here.
Just to begin with, tell us about the catch-up program. What is it all about, and why was it introduced in the schools?
Well, I think going by even the word itself, to catch up, catch up is basically about an intervention that is aimed to ensure that whoever was left behind is at par with those that are ahead. And so when it comes to the context of the Ministry of Education, this concept was piloted in 2016 after the massive realization that was noticed back in the days that, look, we had learners that would progress through the education system. You're talking of primary back then, primary all the way to secondary school. But these children cannot read or write. So the catch-up program emanates from a concept around teaching at the right level. This is an internationally recognized intervention from India in particular, which was rolled out in Zambia in 2016. It was piloted in about 80 schools. The goal of the catch-up system is to ensure that, look, learners do not just go through that education system and they can't read. They can't do basic numeracy. They can't perform basic numeracy. They can't write their name. They can't spell words. So this intervention aimed to ensure that these learners are regrouped. It is in no way that, the way sometimes I think stakeholders have viewed it, like it's a bit of like it's segregating. I think with the learners sometimes they would see it that way. Why our friends being moved from us and they are being taught after school time.
Exactly.
The intervention there is to ensure that you have a Jelita and Mulenga who are lagging behind are given an opportunity to be able to have an ability for them to be able to count. What are the areas or the abilities of this child that a teacher will give that individual approach to say, okay, Mlenga here, count 1 up to 10. So this regrouping of these learners helps them in the long run to be able to catch up with their friends. So far it has been working well. And as of 2016 to where we are sitting currently, we are now in over 6,000 schools at primary level. What does the catch-up do? It looks at learners in the grades 3 to 5. So you see that this is a very critical period around here before these learners go all the way to the Form 1s and the upper, or is it higher education. So this intervention really gives the child that ability to be able to have that, self-confidence that teacher values my inability to count. And in the long run also it assists and helps families to see that, look, their child, to appreciate that their child may not be as good as others. Because I think these are the real issues that occur at family settings, where I think sometimes, parents will be overly, will judge a child based on, the slow learner, and they'll criticize the child. But in the school system, we don't do that. The more reason we have the catch-up system, that the child is given an opportunity to be able to have that ability to read and write, to read and count. And so hence our resolve around it. We have very strong support from our stakeholders such as VVOP and many others that have been on our platform. I think when it started it was a pilot program, and now we are sitting at a national scale. What does this mean? It's a government-led program, an intervention to ensure that in every school, the teachers, they are the frontline individuals that are going to offer this service that as we promote free education, because this is all centered around free education. So what does this mean? For us is to ensure that we have this quality service provision by ensuring that learners are given the opportunity to catch up.
Great. So how has the implementation of the catch-up program progressed so far, and what achievements have been recorded? I know earlier you had mentioned that we are almost at 6,000. Yes.
I think it tells you of past results that we have been seeing at grade 7 level, which of course you're aware that it changes as we roll out the competence-based curriculum. There are a lot of changes that are coming with that. This is an intervention to ensure that we have a population, young people that have skill set that are in conformity with the latest trends, with the 21st century trends. So when you look again at the catch-up, what has been the impact? There has been increased, ability among learners to catch up. There's been increased literacy and numeracy. You have a child who can basically write their name, who can read a sentence. You have a child that can count from 1 to 50, 1 to 100. So that ability in itself has been demonstrated from the way we have been assessing our children. And the assessment is done through our standards and other supporting departments within the Ministry of Education. So the impact is enormous because this is targeting over 2 million learners. Like I stated, it started with 80 schools. That was eastern and southern provinces. And now it's a national scale. So look at it. It has been a pilot. When you are trying a pilot, a project, you assess. If it's not successful, you not go ahead. And for us to be sitting at national scale, it goes to show that it has been successful. And so we have continued. How have we succeeded? We have succeeded through the teachers, because these are the critical people that interface with the learner. The teacher is a very important person in the school system, because minus them, we wouldn't be having these gains where you have over 2 million benefiting from the catch-up program. So the teachers, through the capacity building and their skills that they have attained, and have that ability to engage with the learner, we have seen tremendous progress around the teaching system. So teachers are able to isolate these children, like I stated earlier. They're able to give them activities or lessons that will improve the learner ability. And so far so good. If we're sitting at over 2 million, it speaks to what catch-up is all about.
Wonderful. Are there any measures that the ministry has put in place to ensure that no eligible learner is actually left behind?
Well, it takes us back to why we now have education, free education, as a piece of legislation. Strong commitment from government to ensure that no learner is left behind. Back then it was a policy. It was a policy that it's free, please go to school, and children were at the mercy of their guardians, their parents. Sometimes we had those situations where some parents would opt to take their children, to attend to family needs, activities, farming, name it. Okay. Sometimes even early marriage, has been a thorny issue around children. And so this would take away the children away from the school system. But now that it is law, the children are fully empowered. They are protected by a piece of legislation that is centered around, advancing national development, human capital. You have a people that are educated. You have a people that have a law that protects their rights. So when you come back to what catch-up is all about and why we should ensure that no learner is left behind, it speaks to itself around the free education as a law. Because this law stands by the child, that at no point no one can stop a child from having the opportunity to be in class, to learn, to have the equal opportunity just as any other child from Lusaka, any child from Ikelengi, any child from Chama. So with the catch-up system, like I have stated, the numbers speak for themselves. If you're going to have over 2 million learners, then it means we have strong intervention. We have strong systems around assessment. We have, regional or zonal managers. When you look at it, we have the provincial education officers, we have the district education board secretaries, you have all those support systems, the PESOs and others, the DESOs, you have then the teachers, you have the HODs. So all these structured managers of respective schools of the 13,000, over 13,900 schools, ensure that the system that we are undertaking in the 6,000 schools, which is not easy, by the way, are determined to ensure that the system runs according to the way we want it. Because you're not going to talk about free education or give numbers around the impact of having over 2.6 million back in school. Having them in school is another issue, and also assessing them, assessing the quality is another. So for us, we are not stepping back. Us is to advance. We are going even beyond the 6,000 schools that are currently in our database that we are working on to ensure that we have foundational literacy and numeracy it's fully fledged and it's effective.
Wonderful. Let's talk about challenges that the ministry has gone through in implementing this program. We talk about some of the challenges.
Well, I think we can speak so much about the good, but to every good, usually there's always some slight teething issues. Remember, it was a pilot. So when you're rolling out, it's not always smooth, okay? You need a lot of change, the change in the mindset of people. You need a lot of capacity building. It required a lot of resources, and government really saw that for us to win, for us to achieve this goal, we will have to allocate a substantial amount of resources around it. We needed a lot of also collaboration with our colleagues. So we did not do it by ourselves when we started. So we had engagements such as the VVOB that we have been closely working with, TAO Africa among them, UNICEF also has been very helpful. So why did they come on board? Because we had that challenge. The challenge was there. You had children who were progressing through the school system who could not read and write, like I've earlier stated.
So, like in my time, I remember you find you're in grade 6,
yes,
but your colleague can't read.
Yes,
they are failing to read.
So it was all just about progression all the way, and you write grade 7, and the results would show. But look at the grade 7 results that we get nowadays. See how we are celebrating the 70% pass rate in the grade 12. It's some of these interventions to ensure that, look, yes, we're doing well there, but we should not forget where these learners are coming from. So we're dealing with these issues at the foundational level. So yes, the challenge, the teething issues were there, but we have dealt with them. If we started with 80 schools in eastern and southern provinces, and now we are sitting at over 6,000, it tells you something, that we are doing something right. And so we have dealt with those challenges. Who has helped us win? It's the teachers, the frontline individuals that interface with these learners. And so really their challenges were there, but we have managed to deal with them. The challenges also are there in the individual learners, because remember, these children are coming from homes. Are the parents supportive? And if the community is not supportive, then the challenges linger. So this is why we continue to call upon the communities to help us, that as much as we are committed to ensure that we leave no learner behind, also in a home setting, parents should be very interested to know how their children are progressing. It's not about just picking a report form. It's not about scolding a child. You're not doing well. It's about also understanding, how is my child faring? So the home system has a bearing on how the child progresses. Sometimes the child will do well at school, but the moment the child goes home, tends to scale down in the interventions that would have already begun rolling out in that individual child. So the challenges linger from the community side as well, because from the school system, ours is to ensure that we expand the school system, the classrooms, the desks, more teachers. And so they were there, the challenges. We have minute as they are, and we continue to deal with them, because look, we're dealing with human beings here and communities. And so pulling in one direction together helps us to really minimize and further reduce where challenges lie.
Great. I know you've given a message to the parents, to the community, and teachers out there, but I want you to emphasize, what message would you like to share with parents, learners, teachers, and communities about supporting this catch-up program?
Well, I think to start with, nowadays little ones watch TV. Our appeal to the little one is, we love you, the education system loves you, and it's there for you. Our role through the Ministry of Education is to ensure that they are not left behind. This is why, again, I must emphasize, free education is law. The community must be reminded that free education is law. No one will change this law. If ever one decided to ever change it, it will have to take a long process. We know how the legislature plays out. And so we're excited that we are armed with a law that ensures that this little boy and girl has this opportunity under the catch-up program to be regrouped with their friends, to be put in a corner, not based on segregation, but based on an intervention to ensure that they catch up with their friends who can be sharp, relatively sharp. We have these learners that are, they have this ease, this ability, but when they are around their peers, sometimes there's this atmosphere it creates with the ones that are slow learners. So we value the slow learners, and our message to the parents, please support the child. Support that boy child, support that girl child. When you identify the child is not doing well, and that's why we value the parents, guardians, interfacing with their teachers. The more reason when we have those days you have the parent-teacher arrangements for them to interface. So this child is not doing well in math. This child is not doing well in science. What is the role of the parent? The parent should support the child. Our role is to ensure that we pick up from where the child is failing. We bridge the gap. And so our plea to the communities that do not just leave it to the school system. You are the ones living with these little ones, our babies from ECE levels, and now when we're looking at what catch-up is all about around the grade 3s and the grade 5s. Really, this is a critical period that you need to support them. This is when the child is discovering themselves. Can I count? Can they count 1 up to 5 using their own fingers? So if they're not able to, what is the intervention? Do not scold that child. Support that child, and you make it even better for the teacher in class to help and put up mechanisms that will really enable a catch-up system thrive in that child.
In case you've just joined us, you are watching Zambia Today, and we are looking at some of the key achievements by government through the Ministry of Education. And my guest in the studio is the Principal Public Relations Officer, Mr. Clive Kalunga. Sir, let's talk about the Healthy Learners Program. I'm aware that the Ministry of Education is in collaboration with the Ministry of Health has constructed healthy rooms in schools across the country. Tell us about this program.
Well, again, this is why we pride ourselves to be the best and the biggest ministry. The health program, we are famously known to have these small rooms. If you've ever visited a school, you will likely see one isolated room that has an inscription, health room. Excuse me. What is this all about? This program or initiative supported by the Healthy Learners, who are our all-weather partners, very strong, very supportive organization, in collaboration with the Ministry of Health. We have this intervention that is aimed at giving a system, a first line of health provision. What has been the realization around it? Back in the days, especially with the girl child, sometimes maybe the little one has come of age, and when that time comes, the child would have that disruption. Now, with the coming of the healthy rooms, these health rooms are designed in such a way that within the school system, you have teachers that are trained in health provision. Yes, there were a lot of conversation about it. I think we saw from some stakeholders who had their reservations about, maybe we are exhausting these teachers who already have a lot to plan. They have lesson plans. They have to manage these little ones. It's not easy. Why are you now involving them? This involvement is a deliberate act like we have looked in the first part of our program, that the teacher is a critical individual in the school system. You cannot win, you cannot achieve, you cannot attain the intended goal if you do not equip or capacitate these teachers. And so we have seen massive trainings, capacity building that has been done around the teachers that have been engaged to undertake these this initiative. We go as far as in 1,060 schools. So this intervention is really critical because it has reduced that gap we had. We had learners just over a headache, or a child is not feeling too well, the child is meant to go home. The child is meant to walk a long distance to go and seek medical provision. But now we have a health room that has a bed, that has that trained teacher who will provide the first, the basic health services to that learner. What does that do? You find sometimes that the learner is given, is treated, and the learner is given an opportunity to go back in class. So we have reduced that gap, because this was a problem, that when a learner is meant to go home, okay, get your books, go home. Sometimes the guardians are not there. So you cause that disruption in the learner. And this is why we saw it fit through our partners that we should have a health room where a teacher understands the basic services that will need to be provided to that individual learner, given in respect, of what the learner is suffering from. So it has worked out well. No wonder now we are sitting at over 1,060 schools. So this demonstrates that, look, for us, when you talk about free education, it's so many things. There's so many facets around it. We are feeding the pupil. I don't want to go in school feeding because it's another exciting topic. But even after feeding these little ones, we have a health system that will look after them. So we're still keeping the little one in school without disruption. So we're excited that we are sitting at a behemoth number of places where this dedicated room has been built. And most schools have had these rooms built. And so the Healthy Learners Initiative has been very supportive, and we commend them that really this demonstrates our commitment to ensure that a child is kept within the school system, regardless of what occurs around it.
Awesome. Let's talk about the health services that are being offered. Maybe you can share some of the.
I think when you look at the basic services that are given, I think it's about assessing, body temperature. What is this all about? It's about assessing. I think we know these assessments that are done when one is not feeling too well. And so these are the interventions that have been rolled out through the training of the teachers. The specific teachers that have been trained, they know what to look out for. If it's something that is more serious, that is more concerning, that requires further specialized medical treatment, then there's a referral that is done. But like the basic issues of a headache, a learner not feeling too well, a learner hurts themselves within, when they are playing, the little ones can be all over the place, enjoying their space with their friends. So the teacher will provide that. We have the painkillers, we have various drugs that are provided by the teacher. So the teacher is trained when to escalate a matter. But if it's within the confines of the school that the school system, the health room can provide, then we provide those services. Mind you, in these rooms, we even have beds. So if the learner can be given time to even rest, we provide that. So if within 2, 3, 4 hours the learner feels better, we release them. If we have an issue when to escalate it, then we can escalate it. So we are not letting go of a learner just because one is not feeling well, go home. We start by first assessing them. If it's something we can manage within, in no time the learner is back in class.
Awesome.
Yes.
Mr. Kalunga, as we come to the end of the program, what are your closing remarks?
The closing remarks really is that we are excited as Ministry of Education to be where we are. These milestones we've recorded have not come easy. They postulate team effort. They go as far as teachers. They go as far as the community. Without the community, without the dedicated staff within the school system, we wouldn't have attained these numbers. And our resolve is to ensure that we keep pushing for more. Remember, we are a population that is growing. We are sitting at over 20 million, and you have learners, over 6 million learners in the school system. That means that we need to join forces. We all need to be into it. We need to own the education system, that we support it, and that at no point no learner should be left behind. And that's the more reason, like we started with our topic on the catch-up system, leading us all the way, for us sitting at 1,060 health rooms, it demonstrates that there's commitment, our partners that are supporting us. It means a lot to the education system, and therefore our call, our clarion call, is for parents to continue to support the school system by letting their little ones be in school. Free education is law.
Great. Thank you so much for coming through to the program, sir.
My pleasure, too, for being here.
Viewers, we have heard the achievements mentioned reflect government's continued commitment to improving equitable access to education, enhancing the quality of teaching and learning, strengthening school infrastructure, and promoting learner welfare throughout Zambia. Thank you for watching. This has been Faith Katai on behalf of the entire Zanis production team. Bye-bye.